All right, next we have with us Dr. P.K. Harikumar, who's a consultant, cardiac, thoracic and vascular surgeon. He holds 13 years of complete experience in the surgical field. He has single-handedly performed 4,000 cases, including both adult and pediatric cardiac surgical cases independently, which also includes CABG with a total arterial revascularization valve replacement. Listen in.
Expert insights on cardiac surgery.
Which is the most common type of cardiac surgery?
CABG, commonly called as a bypass surgery. It is done on the for the blockages of the coronary arteries. Coronary arteries are actually vessels which supply oxygen to the heart.
Offering new hope to his patients.
If there is a message for our viewers from you.
See, the heart is one of the few organs in our body which is continuously working without any rest. It beats around 1 lakh beats a day.
NewsX India A-list proudly recognizes Dr. P.K. Harikumar for excellence in cardiothoracic surgery.
Hello and welcome. You're watching a very special episode of NewsX India A-list. I'm being joined by Dr. P.K. Harikumar. Dr. Kumar, we don't have enough time with you, sir, so I'll get right into it. My first question to you, sir, which is the most common type of cardiac surgery?
Yeah, the most common type of cardiac surgery is called coronary artery bypass surgery, otherwise called as CABG, commonly called as a bypass surgery. It is done on the for the blockages of the coronary arteries. Coronary arteries are actually vessels which supply oxygen to the heart.
Absolutely, sir. And what are the possible reasons for getting a cardiac surgery today?
The heart is actually basically a muscle pump, which almost pumps like 1 lakh beats a day. It is basically made up of muscle, and it's got a covering called as pericardium, and it has got 4 chambers, and it has got 4 valves, and the arteries supplying the muscle pump. So disease can affect any of these 4 components. It can affect the coronary arteries, leading to heart attacks. So we might need cardiac surgery for that. It can affect the valves. Valves are nothing but like doors in between the heart chambers. So there are 4 valves. The disease can affect them. So we might have to repair or replace. It can also affect the chambers where there are abnormal holes, where some children are born with holes between the 2 chambers. So cardiac surgery is needed for all these things.
All right. At the same time, sir, of course, you've told us about the most common cardiac surgery, but what are some of the other various types of cardiac surgeries that are now available today?
Yeah, basically we can actually say cardiac surgery in the adult where the coronary arteries are involved and we have to do a bypass surgery, and the valves are involved where we may have to repair and replace the valves. And some children are actually born with diseases like abnormal holes in between those chambers. They can also have abnormal sizes of these chambers, where one chamber can be big enough and one chamber can be very small. And the arterial supply also sometimes in the children are affected. So basically, we can say we have adult cardiac surgery and pediatric cardiac surgery, where the cardiac surgeries are done in children.
At the same time, sir, how risky is cardiac surgery and what are some of the common complications involved?
The cardiac surgery is not as risky as before. There's been so many advances now, and cardiac surgery is a very commonly done surgery and is relatively safe. Having said that, the complications or risk, it depends on the type of surgery we do, the heart's condition, whether it's weak or whether it is strong enough to tolerate the surgery. Sometimes extremes of age, like in very smaller children, having low birth weight, malnourished children, the risk is quite high. And sometimes in a very elderly patient, the risk is higher. And when other organs are involved along with the heart, for example, the kidney is involved, when there's a stroke, the risk is quite higher.
Okay, and I'm
Normally,
sure, right. Go ahead, sir, please
Yeah.
complete your point.
Normally, the common surgeries which we do, bypass surgery, for example, closing the hole in the heart, these are very relatively safe surgeries. They carry a risk less than 4%. And there's a chance for success almost like more than 95%. So cardiac surgery nowadays is relatively a safe surgery uh, to be done.
Okay. At the same time, sir, I'm sure audiences want to know what are some of the post-operation precautions that every patient who's had a cardiac surgery should be following.
Yeah. The most importantly, the patients have to follow our instructions. They need to take proper medications, keep their diabetes under control, and the blood pressure under control, follow the instructions. And secondly, cardiac surgery is something where the post-operative exercises we advise them, and the post-operative physiotherapy is very, very important. So they need to get the physiotherapy regularly done and regularly do their exercises and of course follow the lifestyle modifications we advise them. Most importantly, they need to stop smoking and do some dietary health, take some healthy diet to avoid further complications.
Absolutely. And at the same time, Dr. Hari Kumar, I'm sure people watching would also want to know what are some of the recent advancements as far as cardiac surgeries are concerned.
The recent advancement mainly is what we call as MICS or minimally invasive cardiac surgery. Normally and traditionally, we need to open the chest in the front and break open the bone, which we call as a sternum in front. Nowadays, the cardiac surgery can also be done in few selected patients, not in all patients, in few selected patients through the side with a smaller incision, what we call as minimal invasive cardiac surgery is mainly the valve repairs or replacements and coronary artery blocks can be done through a smaller incision from the side, and we can avoid opening the cut opening the bone in front.
So besides having to, not cut the front part of a person's body, what are the other benefits of this minimal invasive cardiac surgery, sir?
Yeah. The benefits are, the first thing is the healing is faster because we go to the side and the incision is smaller. And secondly, the pain is also is less compared to the traditional cardiac surgery. And thirdly, the patients get discharged sooner than the normal cardiac surgery, and they can get back to their work sooner than the normal cardiac surgeries.
Dr. Hari Kumar, thank you so much for enlightening our audiences with all of those details. But before we let you go, if there is a message for our viewers from you.
Yes. See, the heart is one of the few organs in our body which is continuously working without any rest. It beats around 1 lakh beats a day, and it's very important for us to take care of the heart. Make sure that you screen yourself or have a regular heart checkup if you're more than 45 years, and especially if your family members, one of your family members has been affected by cardiac, any cardiac condition in that young age, you need to be more careful and make sure you have a regular exercise and stop smoking. Most importantly, stop smoking and take a healthy diet and most importantly, try to avoid stress. Of course, many of us, it's very difficult to avoid stress, but have some methods like, for example, yoga or meditation to avoid stress.
Absolutely. Thank you so much, Dr. P.K. Harikumar, for joining us on NewsX India A-List.